Hello everybody, I am Dr. Sampurna Ghosh, ENT consultant in Medicover, Hyderabad. Today I have a CT scan in my hand. I am not a radiologist, I am an ENT specialist, but why I took this? Because I want to explain you what is the sinus scan. So when we ask CT PNS for a patient with nose block, sinusitis or other reason, what are the things we see in this and how do we decide the treatment course? Just a simplified view of that. So let's shift to the CT scan now. Now the CT scan machine takes picture of the skull in different angle and takes multiple small slices. This cuts, what you are seeing here, is called coronal cut. What is coronal cut? So this is the face. Imagine you are getting slices of the face like this, in this orientation, that is coronal cut. If the cut is taken like this is axial, and if it is taken like this, then it is called sagittal. I will describe today the features, salient features in the coronal cuts. So you can see this is the frontmost part of the face where you are seeing the tooth here, upper jaw, central tooth, and the upper eyelids are visible, and then these are the nasal bones. This structure is called septum. In this coronal cut, you are seeing the tooth here, upper jaw tooth, the eyelids are coming. This is the scale in centimeter. This is 5 centimeter. So each picture we are actually moving back by 1 centimeter. As you can see now, the lower eyelids are also coming, and here you can see the full eyeball. So this is the orientation, and now you can look into the septum. The septum in this person has little bending like this curvature. This is called DNS or deviated nasal septum. What are the sinuses we look into? There are different group of sinuses. These two, the triangular space you can see from front to back, they are called maxillary sinus. These are your cheekbone. Coming to the other group of sinus, this one, the pair of sinuses in your forehead, this is called frontal sinus. The group of cells here, multiple small cavities like a honeycomb, they are called ethmoid sinus. The deeply seated sinus in the back end of the nose is this, which is called sphenoid sinus. Now, coming to normal sinus versus diseased sinus, look at this color. The color of right maxillary sinus here is black. Black means it is filled with air, which is physiological, normal. Whereas this side, the color is grey, which means something abnormal is going on here, which is not healthy. So this is color of a normal sinus, and this is color of an unhealthy or diseased sinus. Here you can see little grey outline. This is called mucosal edema. What are these structures? This claw-like projection, they are called turbinates. Look at this side. This turbinate is normal, and this side it is big, huge. So when a person has a huge turbinate, that can cause nose block. DNS plus big turbinate is a cause of nose block. What else we see here? We also look at this structure. This is the end of the nose and beginning of the throat. This structure is called adenoid. This is adenoid. Adenoid is a normal structure, should be present in kids, but in adult it shouldn't be present. Adenoid hypertrophy can also be a cause of nose block. So any infection in this or this sinus can be cause of headache, facial pain, or deeply seated headache as well. So the purpose of explaining the CT scan is not to make you guys confused, but just to give you an idea that every episode of cold or headache does not necessarily mean that you have sinusitis. So to diagnose sinusitis, you should come to an ENT specialist. We do endoscopic checkup, we ask you symptoms and questionnaire, and then we also look into the CT scan. So there are very salient features of sinusitis which can be easily diagnosed in the CT PNS. Sometimes the person who has been believing for years that I suffer from chronic sinusitis actually turned out to be having normal sinus. The headache may be because of migraine. And sometimes the person who doesn't know that he or she has sinusitis can be diagnosed with sinusitis in the scan. So the scan is an important tool for an ENT surgeon to diagnose the disease, to make the treatment plan. Also, it helps us during the navigation in the surgery table when I do endoscopic sinus surgery. Thank you.